United States of America, to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. I'd like to turn the oath to our representative of local health, and Dr. Cole. Thank you.
Yeah, we're going to go ahead and go. Sure. We're encouraged them to be on
Very fun. Good evening, everyone. My name is Gina Marie Bounds. I'm an AVP in Pediatrics for Northwell Health.
And my name is Dr. Vera Foyer, and I'm a child and adolescent psychiatrist and AVP for school mental health at Northwell Health. And thanks so much for having us tonight. And we're here to give you guys an update on what is at this point almost 18 months of collaboration with the Behavioral Health Center. So I'll start first by giving a little bit of an update about the clinical side of things. This program has multiple faces and multiple important things that we're trying to help the school communities with, one of which is clinical care that happens at the Behavioral Health Center, where this is our graph for our weekly volume from the very beginning. And we're, like I said, a year and a half into this. You can see that big dip around week 13. That was the lockdown week last year. And then fairly low volume through the lockdown. And then, since school has been back up, week by week, volume has been increasing and creeping up, which was expected after the pandemic. This is a snapshot of 2020, and then I have one of 2021. This is across the 5 districts. The first year, we saw 439 visits. About 50% of the kids that are seated at the Behavioral Health Center are referred by themselves or by their families, so self-referred. They know of the center existing, and they come seek services. It's open to the community to do so, and about 50% of them are referred by the school staff. About 66% of the kids that we see are initial evaluations, first time we're meeting them or the one time we're meeting them, but about 34% are follow-ups, because the center, other than providing walk-in access for child psychiatry evaluation, also serves as the crisis bridge to help families get services while they're waiting community providers, because especially through the pandemic, we're learning that, services are really saturated. It's difficult to get in, to get care. So kids that really need care immediately keep coming back to us for follow-up appointments until they link. Right now, we have 5 school districts in the center. East Rockaway is the smallest district participating, but the mightiest. Those are that's the split of how much the service is utilized by districts. It is pretty proportionate to size. So the districts utilize it proportionate to how big their student body is. And then you can see immediately with the next snapshot that 2021 already has brought a lot more visits to us than 2020 with the pandemic, because compared to the 430 kids that we saw all year last year, year to date, including May, we have seen 323 visits. So really the volume is increasing, and we expect to continue to do that. And the splits about initial and follow-up and self-referred versus school-referred is about the same, but a little bit more self-referrals and more follow-ups this year compared to last year. So that continues to remain the trend on the service. Sorry. So this is a specific East Rockaway slide. This is all the East Rockaway assessment. So Here, about 60% of the referrals come from the school and 40% of the community, pretty close to the average of the center. And about 54% initial and 46% are follow-ups. So a little bit more supporting of families to get to care happening in this district. And I'm sorry, that other slide is a little confusing, but that summarizes all the positive linkages. So most kids are able to get linked. Some of those referrals are still pending. This is a quick snapshot. This is 1 month volume that I pulled. I think it was March. Just on any given month at the center, what are the most common chief complaints that we're seeing kids with? Most kids present with depression, depressive symptoms, almost as much with suicidal thoughts. Oftentimes the two are together, and some of those kids have both. And then anxiety, behavioral issues, and ADHD are lower on the list. So really the bulk of the kids, which is the case in the hospital too, and on crisis services in general, depression, anxiety, and suicidality are the most common reasons why people seek immediate care help. So with that, I'm gonna give it over to Gina Marie to give a little bit of update about the collaborative side of the partnership and what were some of the things in these last 18 months that we really discovered together that would be helpful, and working together with all the districts came up with.
Aside from the immediate and urgent access to care, I think the greatest win in the partnership with the school district has really come out of the collaboration or the consortium between all 5 districts and with Northwell. So what we implemented a biweekly PPS meeting, which all of your PPS staff attend, and it's actually very well attended. In those meetings, they're really open if we want to talk about case conferences, not using any patient identifiers, of course, but just situations. We do some professional development in those. And we use those meetings to kind of guide what's happening in the district, both from what we're seeing in the clinic, but also what the PPS staff are seeing in the schools and what they're challenging. This was especially helpful during COVID. Who was struggling with food insecurity, who was struggling with getting their kids to sign on. There was a lot of fear on the PPS staff about losing touch with the kids who went fully remote, knowing that those kids had left on March 13th, struggling in certain aspects of their life. So it also kind of worked as a support network for each other. We know that the schools were burdened so heavily, both when the school shut down, but then again when it reopened. So understanding who was hybrid, who was fully remote, who was fully in person, and kind of working with the districts to identify how, knowing that information, how we could help best serve their patients or their students and our patients. We created a monthly newsletter several months ago that we send out the second week of the month. And it's both for the staff, but also for the community. And I'll go into that a little bit next slide. We do professional education through BOCES so that our teachers and PBS staff can get I always want to say CMEs, but to get credit for it, that's the medical one, professional credit for it. We do community education series, which again, through COVID was especially helpful because as you know, in Northwell, we have a wide network of resources. So not only did we focus on behavioral health of various types, parenting the special needs child, parenting a teenager during a pandemic, we were also able to tap into our medical professionals and do, when COVID came out, how it impacts children, vaccines, MISC, and we continue to have those follow-up education series for the community. We did a specific one catered for mothers, working mothers, balancing motherhood, mothers of young children, substance abuse and motherhood. We have worked with the staff to create and worked on grant applications to do stress first aid specifically for the staff. We're also working with the administrators on resilience coaching. And then finally, we're working with all the school districts. What I actually find one of the more rewarding parts of this is this leadership ambassador program and working to create an anti-bullying program, having the high school, usually about sophomore, juniors, work with their school districts to create a district-wide anti-bullying program. So for the newsletter, like I said, this is sent to the PPS staff monthly. It includes professional and community education, both what was already done and what is upcoming. So we have a link to all of our series that were done and to tell about upcoming events. And then additional resources and updates. So for example, in April, we had autism awareness newsletter. In May, we focused on mental health because it's mental health awareness. Of course, in June, we're going to focus on pride. And then we had a PDF version sent to the community so that they had all those links as well. Some of the professional development we've done for April through June is listed here. I won't go through all of them, but of course, coping with COVID, grief, and autism, suicide risk and mitigation, substance abuse. And again, these are pretty well attended, and we offer them twice. So that way, depending on a teacher or PBS staff schedule, that they have an opportunity to attend. And these are done during the school day. Yeah, so they go on that learning platform through BOCES, and then it's available to them for free, for the community, so they can get their credits. And then, of course, and again, these topics are catered around what we're hearing from your team. The PBS team says we'd really like something on autism, then we're going to bring our experts in and we're going to cater the program for that. So it really is kind of a two-way. It's actually a custom-built professional development for what we're hearing from your teams. Mm-hmm. Mm-hmm. And again, offered twice. So an AM session and a PM session. So that way, if a teacher couldn't attend one, they had an opportunity to attend one that would better suit their schedule.
They're 2-hour sessions. They're usually 90 minutes, the review of the topic, and then 30 minutes for discussion and questions.
Mm-hmm.
Yes.
That's in the consortium.
Mm-hmm. And it's a mix of districts, which is also a lot of times very good for, discussing best practices and learning from each other.
Mm-hmm. On the community front, we have regular community education series. It usually winds up being about once a month. Sometimes it's twice a month. This is just an example of some of our bereavement, talking to kids about race, racism, and anti-racism. This was an interesting topic. This actually came from the high school students that we work with in our ambassador program for anti-bullying, kind of as a common theme that they wanted to know and learn more about. So in that program, we brought in someone who was an expert and talk about racism and anti-racism. And then because it was, such a topic that was important to them, then we offered it to the community for the parents. Parenting kids with behavioral issues, and of course, youth suicide and how to prevent it. And then, of course, a piece of that was how do you talk to kids post-trauma or post-vention. Upcoming events, we have our Cohen Strong graduation next week. That's our anti-bullying ambassador. Tomorrow. Like a week behind. It's tomorrow. And so for your students that are, it's Gabriella and who's that? I'm totally forgetting. I'm sorry. Oh, Jason and Brandon. That's right. We're working with three. We're working with 3 districts, but yes, they could.
Junior high school students. So the students from East Rockaway through Cohen Strong, their project. The Cohen Strong program is a ambassador peer training program through the year that culminates in a project that the students do in their schools. And the East Rockaway students did a project where the high school students that participated created this series of orientation welcoming sessions for the incoming junior high school students, and ran a series of Wednesday sessions for a month. For them, brief 15-minute, I think it was, Vinny. And so they're going to showcase that tomorrow night at the graduation.
Yeah. It was a lot of work, but they were so engaged, enthusiastic. Yeah. And we're hoping that that's the type of program that will live on after they leave, and get built into kind of the culture. And then we have on the 22nd, this is always a very popular and well-attended digital parenting. And then on June 26th, part of our CAT series is maternal mental health. Do you want to talk a little bit more about the resiliency?
Yeah, so just another sentence about the community education session. So another exciting thing about this digital parenting session that I'm hoping to have some of the students, again, from the Cohen Strong program come and help us talk to parents about technology use of their children. It should be interesting. So stress first aid and resilience coaching. I mean, it's just a slide to kind of show these were the sessions we ran for each district administrators. And it was a session for the administrators to both help learn about what stress first aid is, which stress first aid is basically a peer resilience coaching program. Really what it is that acknowledging that we all have stress and it impacts on us. And the best way to manage stress is to learn to identify it early and learn to support each other in a setting. And we're excited. This is the model that our health system has adopted through COVID and really had supported all of our healthcare providers through the pandemic. And it had really worked and really starting to build into our culture. And we're hoping to bring that to the schools and help school administrators, staff, teachers really adopt that trauma-focused peer support mindset and bring that into the schools, because what happens is that it starts as peer support for teachers and administrators, but then it becomes peer support for kids and students and families once it's weaved into the culture of the school. And then really whatever difficulty, stress comes our way, together we learn to navigate it. That's really the idea. So we're hoping to do a lot more with that this coming year. We just started that work with the schools and we're very excited about it. And we have a Center for Traumatic Stress Recovery and Resilience in Northville, which provides care for the community as well as, some of this programming. And then administrative updates, I think back to.
Yeah, just give a little updates. We've grown a lot since we started in January of 2020. We've had a lot of interest from school districts all over Long Island. Before we came up here, I was sharing that after our NPR interview that we did several weeks ago, we actually have interest all over the country of people asking us to help consult build these type of programs, which has been incredible. But for Long Island, we're looking to expand. So for the South Shore, we had 5 school districts, and we had like a full-time admin person and counselor, and then like a 0.8 of a psychiatrist. So we're going to be expanding the Rockville Center site by another additional 2 school districts and extending the hours so that psychiatrist is full-time, 9:30 to 5:30. And then we're going to be offering an evening to extend it out even further so that one day a week at Rockville Center, we have an 8 to 8 session. And then because we're opening a second site, which we'll be partnering with another 9 North Shore school districts and have a site in Mineola, that site we're going to staff a couple of days a week also with an evening session so that parents of either location, if they can't make anything but a 6 o'clock or 7 o'clock appointment, they'll have options between the two. We'll definitely try to keep each consortium to their own site, except when we're talking about after hours care after 5 o'clock. So that's exciting. We will have 4, possibly 5 days a week where we'll be open 8 a.m. to 8 p.m. between the 2 sites. So that really is, full access of care during the week. We're adding a formal consultation. So some of the feedback we got in the first year is that often during the CSE meeting or maybe even put on an IEP, a formal psychiatric evaluation is requested by the school district. And that's often contracted out with a private physician. And from what I hear, very costly. So we're going to add in those formal consultations at a discounted rate. And it could be an add-on ad hoc service should any district within our partnership want to have a formal consultation. We're going to continue the stress first aid for the staff, and we're going to expand that out further. We continue to work on grants. Everything that we talked about that we offer is for the same fee that we went into this a year and a half ago. And so we try to work, our goal is not to increase the cost of the districts at all for the additionals, but that to work to secure grant funding. And like I said, the Mineola Behavioral Health Center is going to have another 9 school districts that we'll be partnering with. And that's going to allow us now to offer the evening hours between the 2 sites. Yeah, this is just our continuum of care. We always conclude just talking about the kids at the top are the ones that need the most urgent, immediate access, which is why we went into this partnership. But really, we're offering services throughout the entire continuum because the goal is to start early intervention, access to care, and really limit the amount of kids. We will always need crisis services, but we really want to kind of make that the smallest end of the pyramid. And I'll just leave this up, and I'm happy to take any questions, but this is just about all the services that we offer through the contracted rate that we have with the school districts. Is it 80%?
Yeah. So, I mean, the barriers unfortunately are numerous, and we're trying our best to navigate them one by one, case by case. A lot of times it's insurance. Many of the clinics through the year that accept insurance or accept a variety of insurances have reached capacity at various points and shut down completely for community referrals for months at a time. So, and many of them in the area that are the common ones that we've utilized before, we're hoping to utilize. So that was one big barrier. Some part of it is the usual losing, the crisis passed and the family is no longer interested in services and they don't get back to us. They no longer want to, get help to connect, or the problem passed. So there's some percent of that. But navigating insurance and navigating available providers has been definitely a big challenge. And, unfortunately, it continues to be. I mean, one thing that we've done, and that it still has its own challenges, is that very early on we identified that there's not enough evidence-based therapy that accepts insurance in the area. So if I want to make a referral for a specific kind of treatment that treats anxiety, cognitive behavioral therapy, which has a lot of evidence in kids and really is the gold standard for treatment, unless I can have somebody afford to go to a private provider, if I'm referring to just a general mental health clinic, they're likely not going to get that service. So we've been trying to find providers that accept insurance and do the service. So we identified this as a need and started a small practice that's an outgrowth or satellite of our larger CBT Northwell practice back at Zucker, that they do 2 days a week. They put a part-time therapist here to provide CBT for the kids that we see. And that is great. I mean, it has its own challenges like anything in mental health, with provider enrollment and insurance and how long it takes to really get going with that. But that has helped with some of it. And we're hoping to, continue to expand on that and work with, the needs, not just here across Long Island and everywhere in America. The youth mental health needs have been, vast before the pandemic, and now there's even more. And so really creating more services is going to be important, because we can help. The good thing is that we can help support these families until they do get there. Because right now, that's just the reality we have to navigate, that it takes time to get into care. Yeah. Right. Right. Yeah. So.
And part of that is really because, actually, the main part of it is because of this partnership, right? So Zucker could recruit the psychologist, but it's not cost effective to pop them up all over Long Island in a practice. When you do the rent, the staff, or what they get in reimbursement, it's a very negative financial outcome. But because we're already there, we're already open, and we already have the space, particularly in Mineola, where we're going to have our psychiatrists there seeing patients till 8 o'clock at night. Why not give one of the rooms to a psychologist? We already have our staff. We already have our rent paid. So we're just give them the room, just see patients. So that is only cost effective. We're only able to do that because of the partnership with the school districts. Otherwise, we couldn't have done that. So.
Other questions?
Thank you.
Yeah. Yeah.
Mm-hmm.
Yeah.
I know. We had no idea what we were getting.
Timely.
Yeah.
Yeah.
Thank you.
Yeah.
I also just wanted to add to what Winnie was saying, the PPS meetings, they really were it's such a nice example of how some of the best things in this partnership organically develop. And also just to put my traumatic recovery head on for a moment, how like the pandemic actually benefited us in some ways, because some of these things wouldn't have happened. Those PPS meetings started as support groups for your school staff during the lockdown, because everybody was just needing support. And we said, why not have a Zoom meeting to have a support group? And then they evolved into these blend of clinical and support meetings. And they really are such a source of inspiration and support for everybody, and really inform us of what's going on in each district. And your district, actually, I do want to highlight that has been really a lead in sharing best practices. Your social worker, who's the most consistent member of any group meeting
Amy.
that we have, I think, Amy.
Yeah.
She has been wonderful in sharing some of the things that have been developed here and sharing it with the other districts. So, really has, I think that has been a very, important part of the collaboration.
Yeah, she's a gem. But I do want to say thank you, because we came to you with kind of a crazy idea, and the 5 districts on the South Shore were the pioneers that took this and believed in us, and Vera and her team know how to provide excellent mental health care. We didn't really know what this partnership was going to look like and evolve to. So thanks for trusting in us. And you guys were in and locked in. And like I said, we're probably talking to another 35 districts right now, trying to manage how we're going to help as many as we can. But it's really a testament to you believing in something that was innovative and out of the box and doing what you had to do for your community. So I really applaud that. And I think it's really impressive. And East Rockaway is lucky to have all of you. Mm-hmm. 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 Well, I think what we realized, what we experienced last spring being in healthcare, you were experiencing in the fall in a different way, but that same intensity and trauma and fear and burden. So it made sense to translate what we were working on our frontline workers to your front lines.
And we heard so much, to your point, like it is from those meetings that we heard so much about how much the staff needs support. And then we have, in addition to the bi-weekly PPS meetings, we have every other month an administrator meeting where all the superintendents and PPS directors of the districts participate. And in that administrator group, it also came up as a topic of we're also busy trying to support our team, but what about us? And we're scrambling. And so, that's when this idea of doing this program to the administrators themselves, came about. And I think it was great. I think, East Rockaway has the smallest but most cohesive administrator group. And it was, I think, a great session, and everybody participated. And, I think it has a lot of promise, that model, because trauma-informed schools have emerged as a mental health model many, many years ago. And that has been something that, your school district and other districts with the resources that you have try to, instill in classrooms and as part of the curriculum and as part of training. And this just brings that into another level and brings it to the administrators and brings it to our staff and how can we use those same tools to help ourselves.
Thank you.
Thank you so much.
Great job, man. Thank you so much. Thank you. I heard you on Boomer Apartment. Months ago, I guess.
Yeah, thank you. Good back. Yeah, we got some traction out of it. It's great. Really good stuff happening. Yep, thank you. Yeah, really amazing.
Thank you.
Terrific.
Testing 1, 2. Okay. Continue with tonight's agenda for our work session. Minutes and agendas. Minutes from May 25th, 2021. Any questions on the board members of that? Any observations?
I actually did have a question on the recognitions.
I'm sorry.
The recognitions, the thank you to Donald Craven. That everything came through.
We did not, I don't know if Mary heard back from his office. We reached out and asked if they would be present, and I think we're waiting to hear back.
Okay, so that would be both him and Councilman Diaz-Padrino.
I think that's fine. I think we were inviting Councilman Diaz-Padrino. Yes, I'm sorry. I was confused for a minute. Yes. We also received notice that, let me just get the paper that I was waiting for confirmation from the individual who, we received a lovely letter today from, actually the other day from Don Clavin Jr., supervisor, regarding a frontline hero. So on behalf of the members of the Hempstead Town Board and on a greater scale, the larger township of the county, I commend your bravery and courageous acts and thank you for your admirable assistance during COVID. For Mr. Jimmy Lores, who is nominated by Mr. Volpes to receive a Town of Hempstead Frontline Hero Award. So Jimmy Lores, did receive his pin in the mail, which I know he already framed. And we would like to recognize Mr. Lors as well.
That'd be great.
Because that's really an honor and so well deserved. Jimmy is amazing through rain nor snow nor sleet nor hail. He is always available and has done such a yeoman's job throughout COVID and every day. And he certainly deserves some recognition. So we'd like to add that. I
Have
know
you told him you recognize him?
yeah, I just saw him this evening and asked if he would be available.
That's probably a bad move because he won't show up.
Well, he told me that there's a girls' game that night and that it starts at 4:30 at Rame and he should be finished by then. So,
That's great. Yeah.
so I'll just
Jimmy has a
confirm
hard
with him.
time accepting, thank yous,
Yeah.
and publicly like that.
He'll
Sometimes
stay in
you
the
have to
back,
go there
I'm
and
sure,
yeah,
and wave,
I'm sure he
but
will.
at least, yep.
Yeah.
It's his spot. It's his
So-
out of the limelight. That's why he's a perfect candidate for that award, Really was perfect.
He's so understated, but very much, believe me, we appreciate him. We all appreciate him. He is amazing. But it is a very long agenda with many awards. And so I was a little concerned about the occupancy because we will be recognizing all of our staff members who acted so bravely and kept our children from harm on the incident that we had. So we do have a total of 78 seats that are available in the auditorium, including the balcony. So we may need to break and have some people leave to allow other people in so that the people who are being honored can be here. So we'll plan a schedule and send out some sort of an announcement that we may need to ask some people once they're finished if they wouldn't mind leaving to allow other people
Right.
to come in because we may have a full house that night.
Okay.
So I will work on that. Just to make sure that we don't have to turn anybody away who's being honored and whose family may be coming to see them honored.
Okay, that's great. Questions, any other questions on the board agenda? On the 15th. Okay, moving along. Items for discussion, Cohen's Children's Northwell Health Physician Partner, Pediatric Behavioral Health Clinic presentation, which we saw already this evening. I'm just, it was a perfect time, perfect place, everything fell in line, and they're doing a fantastic job. And it shows how we have 9 other districts now, correct, that want to join from the North Shore. Is that right?
They'll be joining in the site in Mineola.
Yeah.
So, yeah, they have to turn. There will be 2 other districts that are joining our site. And because of that, we were concerned that it may impact on the services, but they are adding extra hours and they're increasing the psychiatrist to full time. So we don't anticipate any decrease in availability for, our families because of that.
And no talk in increasing the cost, correct?
No, the cost is the same, and we are able to bill that through BOCES, which was wonderful that they worked with us. So the first year, as you know, Senator Kaminsky arranged for us to receive a discount. He worked with Northwell Health, and it was at a lowered rate. And then the second year, we were able to bill through BOCES. So it's a win-win for us.
Board of Education meeting dates, 21 to 22. I can't believe we're looking at them already.
So these dates, some of them are still to be determined. We need to build the April dates around the BOCES vote and budget adoption and the budget hearing. And so, Jackie, we're still waiting for those final dates.
We didn't get the timeline, but I can pretty much backwards on the calendar. The March dates I had proposed both the 8th and the 15th so that I could get the first publication in on March 22nd. I see those dates still later.
So we'll back into those dates then, and then we'll put them up on next week's agenda for approval, and then if we need to make any changes, we can always do that.
Everybody okay with the August 24th, the walkthrough?
Yeah.
You guys check on that because that could be changed now. It's no good.
We had also tried to have an early August meeting, so we would need to look at those dates. And I can ask Mary, we could look at all of our vacation schedules and see if we can, Mary can put out some proposed dates for early August.
Yeah, that 24th is the problem with me. I'm sorry. Can we look at maybe a day or two, a day before, a day after? A day before is no good. Day after is good with me. 25th, August 25th, if that works for everybody.
Let me just open my calendar.
I'm away the first and third week of August. But the week of the 9th, I'm home for that board meeting.
Mhm.
So the 24th is no good.
Mm.
You would want to do it on the 25th, which is
25th, can we do the 25th as our first August meeting? Walk through and the board meeting?
that should work fine.
Mm-hmm.
So August 25th. We're good with that? Okay.
Great. Thank you. Jack, you were good?
Yeah.
Yeah, for the walkthrough, right? And then the early one, we'll just wait on until we get a better date, or do we
Yeah,
want to talk about it?
I'll
Okay.
have Mary poll the board.
Uh-huh.
She can send something out tomorrow. If
That'd
you
be
can-
great.
if you
Yep,
have your
if you
vacation
can.
schedule.
Yep.
And the reorg is July 7th.
Right.
Okay.
Yep.
Okay.
Good.
So this should be ready. We'll send the final draft home on Friday
Mhm.
for approval on Tuesday.
Great. Okay, defeating uncivil discourse in our society. I brought that up on the agenda.
Mrs. Heck? I'd ask Mrs. Heck to look
Yep.
into this.
Thank you.
Yeah, good evening. So there has certainly been a lot of attention paid recently to the readiness of students related to civic engagement, civic awareness, participation in their community. And just to give a little background, about 5 or 6 years ago, students who were graduating for a number of years were required to pass 5 Regents exams, one in English, one in math, 2 in social studies, one in global history, one in US history, and one in science. And again, about 5 or 6 years ago, the state changed the possible pathways and reduced it to 4 Regents exams, and then an additional possible Regents exam, which gave a lot more flexibility, requiring only 1 history Regents at that time, with the possibility of completing a second or a second in another area. So interestingly, at that time there was concern about the reduction in the Regents exams in social studies. But since then, there's been a lot of discussion also about civic engagement and civic readiness. And in 2018, the task force in the New York State Education Department was put together. A lot of work has been done to ensure that student education throughout the years, K through 12, in the area of history as well as civic readiness is addressed. And the ESSA accountability measures, which are, as we've talked about before, the Every Student Succeeds Act, has an index of accountability related to college, career, and civic readiness. That does measure social studies coursework, the Regents' performance and outcomes for students in social studies, as well as their involvement in elective social studies courses and upper level AP courses in the area of social studies. So what came out of that task force from 2018 was in January of 2020, a recommendation for a seal of civic readiness. So that is something that is now on the horizon. There are pilot schools that are piloting the different opportunities for students to get this. It's a point system, so there are ways for students to receive that depending on what courses they take in high school, and also what activities they might be involved in. So there are clubs that can count toward the civic readiness seal. Things like some things that have been included are student government, the Gay Straight Alliance, and different organizations that are within some schools, like a Model UN Club, Key Club, and a variety of others that schools may choose to run themselves. There are also sample electives that some of these pilot schools will count toward the seal of civic readiness, including history of the Americas, constitutional law, a civics class, Holocaust studies. So there's a lot of flexibility, again, with local decisions being made depending on what the schools would like to include in that. And also there's possibilities for capstone projects for students to explore and engage in. And so we in high schools have talked for a long time about community service. And so service opportunities are also encouraged, and they're included in the opportunity for students to earn credits, earn those points toward the seal. So I've been in conversation with Mr. Gibbons this year about this. He's been in contact with his colleagues in other districts. It doesn't seem, outside of some of the pilot schools, that there's a lot of movement right now. I'm sure there's been a lot, with COVID this year and the responses in other areas, but it's certainly something that we're keeping on the horizon, and that he is well aware of, and that we will continue to look at and pursue.
Yeah, it is
Okay.
something we would like to look at, begin planning for that over the summer, and then see how we can develop that. I don't know if it would be all in place for our current juniors, but certainly move toward that as quickly as we can so that we can offer that.
I just think that it's a natural here in East Rockaway, only because many of those things you already mentioned. When I read through it, I said, boy, we do so many of those things now.
Right.
And this is a community that really does service. It's a service-oriented community. So with that being said, I would love us to really be on that horizon with everybody else, getting out there and looking for the seal of civic readiness, and possibly over the summertime having some curriculum developed that would tie up all of the courses that we have, where students would be very well informed by the guidance counselors that this is their pathway to the seal. If they carry this through, they get involved in these community organizations, so on and so forth, so that what Lisa, you just mentioned about some kind of a staff gathering that would put something like that together, have it as an official offering, would be great. And I think it's a no-brainer.
Tremendous.
No-brainer. Good. That's great. Happy to see that we're on board. Okay, the UPK update, additional student slots and the scope education services.
So we did post for the RFP, and Scope was the only vendor, Jackie, correct? That responded to our RFP. And so we are recommending next Tuesday, it will be on the agenda to accept Scope as the provider for our UPK program on next Tuesday's agenda. And so we'll be moving forward then, developing plans with Scope. We have a postcard that will be going out very shortly, probably today, tomorrow. And we do have already over 20 odd parents who have applied. I can tell you the exact number. We have 21 responses right now for 21 responses for the program, which is good. And the plan is for us to offer 2 classes, one at RAIM and one at Center. Each of those classes can have up to 18 students, 1 teacher, 1 teaching assistant. That is the model that we'll go with. We do have funding for 26 spots right now through the grant. So that would mean if we offered 2 classes, 13 in each class. In order for Scope to provide the service, they would require a minimum of 15 students. So we had discussed with the board the possibility of funding 4 additional spots to bring that up to 15 slots in each building in each program. So those would then be free to the first 30 residents that applied for the program. Again, we have 21 students right now. We hope that once the postcard reaches families, more families will apply. We hope we get 30 so that we can run both classes, because we don't want to leave the money on the table. I guess if we did, we can't allocate the funds unless we have the students in terms of utilizing the federal grants. So I do really hope we get at least 9 more families to respond. So it's going to go up on the sign. It's out there. It's on the website. And I think the postcard will cast a wider net for our community to apply. And wouldn't it be great if we had 30 families that were interested and we could accommodate all of them? That would be great. We would then have the option of Scope would handle this, since the maximum class size would be 18. There would be an additional 3 spots that would be open and available, and those would be made available not through the district, but through Scope at a cost. So any parent above the 30 who applied and were not selected in the lottery would then be offered the opportunity on a pay basis to attend the program. And the cost would be exactly what the grant funds per student, which is $5,400 for the year or $540 a month, which I am told is a really good deal for a full day preschool program. The program would run from 9 a.m. to 2 p.m. Lunch is included free of charge. Scope will provide snacks for the students. They will provide all of the materials, the curriculum, the supervision of the teachers. We're really very pleased that Scope has applied, but we have a wonderful relationship with them in our aftercare program. They're very reliable, they're very well regarded, and they have programs in over, I think it's at least 17 other districts that they've been successful in. So we're very confident that it will go well. The only other additional cost for us would be the furniture, the classroom furniture that we.
Oh, great.
So it's win-win. We're excited. The postcard, again, will go out. We'll share it with you. And the lottery will be conducted on next Tuesday evening, depending on, again, if it's 21 or hopefully we get more, 30, at least 30 families. We will invite them to come probably here in the auditorium and conduct the lottery. Literally, you put the names on paper, put it in a basket, and you pick out the names. The names are then listed on a list in order that they're selected, and that's the order that student families are offered a program. Right now, we have, of the families that applied, we have 12 of them are from Rame and 9 are from Center Avenue. So we would hopefully be able to give parents their choice of where they live to attend the program. So we're excited for this to move forward. So please, if you know anybody, spread the word. And we'll have it live here, but we'll probably live stream it as well, so that if parents are unable to come, they can attend and see, how the names are picked in what order.
Yeah, I think that's a great idea to live stream, because this way it's total transparency for anybody who couldn't make it. And even live stream, then we could record it and hold that, if ever need to be. Because you know how this could get. It's a sticky situation if people don't get in.
Yeah.
So that would be great there. I did have a question on the overall supervision now. It's a BOCES program.
Scope.
In our Scope program in our schools. And is the overall supervision under the leadership of the principal of that building, or is it a Scope?
Scope will evaluate the program, but they don't have a site supervisor. So obviously the principal will be responsible for the day-to-day supervision of the class. But the teacher Visits will be made by scope administrators to come visit the program, evaluate the program. Parent-teacher conferences will be held. They will follow our calendar, but actually it's next year we will have 178 school days and 4 conference days. The program must have 180 school days. So that pre-K class will be in session 2 more days than our students will be in session, because that's what's required by law for us to hold. So we will establish that calendar, with scope, what would be when the program would start and end, and work around the conference days so that we meet the 180, because our funding will be reduced by 180th of the total amount if we don't hold school on those days. So, but the principal in general will provide oversight and supervision, of course, of the students. The classrooms will be in rooms that have internal bathrooms, and kids will probably eat lunch in their classrooms, but they'll be able to use the playground, go outside and use, all of the facilities, of course, of the school. If they want to visit the library, if they want to use the gymnasium, anything like that will be, of course, within the school building and the school day. And we are so excited to be able to offer this.
Thank you for all the work that's gone into that, and especially that short window they gave us to apply for the grant at that time, getting that in all, and, even to the point where we've expanded upon what they originally presented us. So,
Yeah, and thank you to the board for that support, to Jackie for funding those extra slots. I think it's great that we can, provide a little more for our community and, run this program and then see how it goes. I also think it's a good start to have scope. They have so much experience with it. They will provide all of the materials, crayons, center work, the curriculum, and of course the hiring of the teaching staff as well as the teaching assistant. And it will, be a seamless way to start the program.
Lisa, do they afford you the ability to post within the district itself on those teaching positions?
That's a good question. I'm not sure. I would have to look for that.
Thank you.
Again, they would be an employee of scope.
Right.
So,
You never know,
Yeah, no.
Somebody who's
I
certified
know-
in the community like to
yeah,
consider.
I know that we, scope oftentimes when we first started and they were having trouble hiring staff for the aftercare program. We had open houses here and we posted within the district so I would imagine we can. I'll be having a call with them to let them know that the board will be approving them as the provider actually tomorrow.
Great, yeah. Okay. Our plan for the expansion of the ventilation project.
Okay. I'm going to let Mrs. Scrio speak about that.
Oh, good evening. Is this on? Yep. So, as you know, in the bond, we have new ventilation in the entire high school as part of the bond project. Right now, our bond is trending about $2.5 million below budget. And, due to the pandemic, there's been a lot of focus on improving ventilation in school buildings. Many of the school buildings' ventilation is quite old. And I don't want to imply that our ventilation is not good here. We are changing our filters. We are running disinfectant through the ventilations. We're running the most. We're doing everything that we're recommended. But of course, replacing and upgrading the ventilation would be the best option should we be able to afford it. So I think at this time, I just wanted to mention to you that we will be improving all of the ventilation in the high school with our bond project and some of the ventilation upgrades in the 2 elementary buildings, but there will be many classrooms and many offices that will still be on the old ventilation system. So right now we're about $2.5 million below budget. Our next big bid opening will be July 1st. By July 7th, we hope to know what that project comes in for. If that continues to trend like the rest of the projects, we may have enough money to actually expand the scope of the work here under the bond and improve the ventilation district-wide in all three buildings with the same funding that was approved for the initial bond. So I thought that now might be a good time to start to talk about that, to start to at least put that on our radar as a possibility. I do know it is a concern of many of our parents and many of our employees. So I hope is in July we'll know a little bit more. And then after we know where we came in with our next largest, because the high school project is the largest project. Once we know where that comes in, we'll have a better idea of the funding that's available. If we should make a decision to expand the scope, we would need to go back out to the voters. And we would need to adopt a resolution here at a board meeting. And then we would be able to go out for a special vote 45 days after we adopt a resolution. So it is something for us to start to consider. Of course, it would be at no cost to the taxpayers. We would be doing it within the budget. And we could possibly, if necessary, use some of our fund balance should we feel it was going to be even higher than what's left. So again, no cost to the taxpayers, but it would absolutely need an additional vote.
Jackie, by that time in July, will the majority of work have been completed on the bond so that we would know, that we're not going to fall short in any of the categories? And we have a 2 million over now, but that could quickly disappear.
Right. And that's a good question. And then I had a long conversation with bond counsel about this earlier in the week because they wouldn't support us going back out to expand the work if we really didn't know where our projects were coming in. Because our athletic project, our Center Avenue projects will be primarily, pretty much done, 75%, if not 90% done by the summer, hopefully done in time for opening the school, definitely at Center. Maybe the athletic fields may go into September. That portion of the job will be completed and we will have already bid out and awarded the other large project, which will be the high school renovation and the tech building. The only piece that would be left would be Rame Avenue, which has got a budget of about $1 million. And at this point, we wouldn't really want to go to the state. We haven't even submitted drawings yet for Rame because that's slotted to be done in the summer of 22. We wouldn't want to submit those plans if we were considering expanding the ventilation because we might as well submit the plans with the expansion of ventilation and try to get approval all at once. So because of where the projects will be as far as completion with the athletic projects and Center Avenue, and because the bid will have already been awarded in July, that's a good time for us to give some good consideration to expanding the projects.
Thank you. Anybody else have any questions on that?
No.
Great. And as far as, since that's in the summertime, right, we're talking then, and just I'm trying to get a timeline for myself now, looking as that would move forward. So back out to resolution, what do you think that would be if everything was favorable for this?
Well, it depends on when we decided to adopt the resolution. If we decide in July and we have a discussion and we decide that maybe this is the right move and we've got the money, we may decide to make put the resolution on the end of August board meeting, or you could put it on September. But it's 45 days from when the resolution's approved. Once we approve the resolution, we would then obviously have a meeting for the public to hear what we're talking. We would absolutely send out flyers to the public like we did with our last bond so that they fully understand that this is an expansion, but this is not an increase in taxpayer money at all. It would just be we need their approval to proceed with further work than what the original scope was. So if we do it in August, we're probably thinking a mid-October vote. Based on the board meeting dates that are proposed here, September 21st would be a late adoption, so we would be into November, 45 days after September 21st. So again, based on the date we decide to move forward, and the final dates for the board meetings.
Yeah, I just my own is that I always believe that transparency starts when everybody is around. And we've had bad history in this county, not in the school district, in the county about, things going on in the summer, not everybody's around to weigh in on. So I'm thinking more that if we are going to go, this looks good and that all that we're looking more to the September, 21st date. This way everybody has an opportunity. They're back, their heads on straight. We have now, everybody back in the buildings at that time. Then we make a good push for it if that's the case. I think that would be better, if we do it then August.
Sure, and that is definitely,
Yeah,
We'll be on vacation.
yes,
Exactly.
absolutely. Doing things in the summer tends to not go over well because people are away. And then that would have a vote in November, which would mean then the submissions for the plans could not go up until after that, which could mean we missed the summer deadline.
So
Um,
Jackie, maybe we could plan for a small presentation at the September work session?
We could plan, we could have a presentation and a resolution at the September 14th. My concern is my only concern here is getting our work project up to the state early because we want to try to get it approved and go out to bid. Because if we don't go out to bid and get the work for the soon approved and out to bid, we won't have the work in the summer of 22. And that would be our goal, is to get the work done in the summer 22. We postponed too long. We're talking about the summer of 23. And and so you have to weigh out, and I am 100% in support of not doing things during the summer, but at the same time, understanding the timeline here, and the fact that we want to have the work done in the summer of 22 so that when we open up for the 22-23 school year, all three of the buildings have all new ventilation as opposed to waiting an extra year because of that couple of weeks. We might want to consider earlier September meetings to start. I mean, I still wouldn't go in August, but we might want to consider something like that.
Maybe we want to, look at our September calendar now, right? We said the 14-21. Maybe we should look at the 7-14.
Yeah.
So if we're looking at that though, I think we should also make sure that this is something that comes up at Super PTA, hold maybe a Super PTA at the end of August so the PTA is aware and they can get the word out.
When it's happening.
Yeah,
going
so
forward.
that way people tune in or show up and are aware. So at least if it gets to as many people, then.
And again, though, once the resolution is passed, we have those 2 months to do
Right.
a lot of promotion because the vote won't take place. The resolution is just to go ahead with the vote. And so from that time, then we can really educate the public.
Yes.
We can have
Yeah.
meetings, go out.
Right.
Hopefully by then we're back to normal. We can go to Kiwanis, we can go to different places and inform the public of what, like we did with the bond. And then, have a campaign, an awareness campaign to
Yeah.
do that.
We're not really, I mean, adopting the resolution is not really doing anything behind the scenes because you do have weeks to bring the community into it. On the 7th, we are closed. Yeah, we are closed on the 7th. But I mean, if you adopt the resolution, on the 8th, that's like, yeah, we're closed with Russia.
It'll be what, Thursday the 9th, right?
And that would be a work session, right?
Yeah, work session we're looking at now.
Yeah, so we're not even adopting at that point. We're
No.
still in a work session.
So we do the 9th as the work session. And then come right back on the 14th with the board meeting. How's that sound? I think it's the way to go. I know we're not adopting or anything, but I think.
Just to get the
the
message
people-
out.
Exactly. Got to get it out
I
there.
think everyone can be excited because no cost is back.
That's
So, I mean,
huge.
major campaign.
Right. And that's why it's got to come out that way together.
The schools are closed 6th, 7th, and 8th.
Jackie, just out of curiosity, what other trends in ventilation? What is, I'm sure you might not even have that information, but what are
For the cost, we're gonna get a good idea when we open up that July 1st bid, because that's the ventilation for the high school. And that's really gonna give us an idea what the trending is as far as the, cost, but everybody is looking at, and that's the only reason why I press, is everybody's looking at improved ventilation in the schools. A lot of districts got a lot of money in federal stimulus funds, and that's what they're looking at. So they're all going to be going out there for approval. They're all going to go up to the state. So we want to beat them. Pretty much that's really what it comes down to. We want to be one of the first in line so that we can get our ventilation bid out and our project done.
Sounds great.
So just to recap, the dates you're suggesting are September 9th for the work session and the 14th for the meeting.
Yep.
Okay.
Thank you, Jack.
Thank you.
Thank you, Jackie. This was a lot of work on Jackie's part, a lot, of discussion and a lot of research. And thank
It's
you for speaking
so exciting. I mean,
So,
to me, it's so exciting. If we could really pull this off. I mean, it's exciting.
The reality is we fell short because of the funding through the bond. We were very conscious of the taxpayers.
Mhm.
So we fell short on meeting every classroom. And now we got ahead, we saved that $1 million on the bulkhead,
Yep.
right? So that jumped us there, plus ahead the other projects coming in lower. And guess what? We could offer this back that we originally couldn't offer. So it's a home run.
Yeah.
It's a home run. Because that's where we wanted to do it. But unfortunately, we had to cut back because it was costing too much to the taxpayers. It's terrific. Terrific. Oh, yeah.
I think so.
Okay. Update on the grant-funded summer program.
Mrs. Hecht?
So I've been trying to keep you abreast of where we are with our summer climb program. We've been working very hard to put together something that would help students to address learning loss while also, again, as I've said before, be engaging and enjoyable this summer. We've had a real challenge to get faculty. We are, of course, working with Nessa BOCES with our program, K through 12 for high school summer school as well. But we just have had really no response regarding math. So at this point, we're making the decision to move forward with a K through 6 literacy program, really grades 1 through 6, our current kindergartners. So incoming grades 1 through 6 literacy program. We will be running the CLIMB program for both literacy and math in grades 7 and 8. And we're also continuing to add a little bit as we go, but a little bit more and more enrichment opportunities for students as well. So we do have some, I've mentioned before, some primary grade STEM opportunities and activities for students. We have some athletic offerings that are being worked on right now, some weight training as well as conditioning for our high school students, and also some music activities as well as a cooking class. So, again, we're continuing to try to get more interest and more activities and more opportunities. Yeah,
It has been difficult. I think the year has been such a challenge for everyone that our teachers are looking for a break, and we understand that. And I know that most districts are experiencing a similar difficulty and challenge in terms of hiring summer staff. People worked really hard this year, and we didn't want to offer. Some districts are offering remote programs in order to offer something, and I don't think that's the way we want to go.
I agree.
The summer, and I think we've all had enough of that, and we're hoping to move away from remote. Maybe some teachers would have been more amenable to taking that on, but I just don't think we all didn't think that was the way to go.
No.
Right. And that will then allow us, look, we have 2 years to spend these funds. We will then be offering some after school, extended day programs, which will also be, I know students will take advantage of those, and we can be very creative. Next year is another year. We'll start fresh. And so it's not like we have to spend all the money this summer. We're going to do what we can. I think everybody needs a break. And then after extended school year, we're also hiring, an additional reading teacher. So we're going to make an effort and expend those funds in other ways that during the school year that will support any learning loss that our students have had. So, and we still have some time to plan for those and make some changes. We did look into scope, and I know we've been, maybe you want to just share, I know you emailed me today, but we didn't get a chance to touch base. We did reach out to Scope because they do run some enrichment programs, but they're,
Yeah.
can we talk about that?
Yes, so, we've also been looking at our physical plant and our ability to, offer certain programs in the rooms that we have available, and we can do it. But I was in touch with Scope, and they also are having a staffing problem, and they said they typically look back to our faculty to staff it. And so, we're kind of going in circles here with trying to get people. I guess everybody's looking for the same types of offerings this summer. I know summer schools, even before this, were plentiful through BOCES, and they were having difficulty staffing. So it's just been a real shortage and a real challenge and a difficulty. But we're continuing to work with them and see if there's some way we can get it going. But it's going to be a challenge.
But we know, excuse me, one more thing. Our parents have been asking for some after-school activities. This comes up a lot. They use the word after-school clubs, but we can look during the school year to develop some after-school opportunities that would be enrichment, that would address the guidelines of the grant, and also respond to what our community has been asking for, especially at the elementary level. We don't offer a lot after school. And, a lot of that is also, availability of staff, but we'll certainly attempt to design some of those for the fall that will, meet that need and that ask that parents have been, expressing.
So just as an idea though, we are interviewing, correct, for positions in the elementaries right now? Is there a possibility of any of those applicants who are applying for those jobs, if they were offered summer employment in this type of program? Because many times, as we all know, when you're hot out of college and you're chomping on the bit to get started in your career, it might be a great opportunity to give to a young person coming out of college for remedial type of work in the summertime. So,
Very good.
I was just wondering, have we thought about that? And if we haven't, could that be made part of our process of everybody who's applying for a job? As we know, we probably got hundreds of those applications, right, for the elementary positions. Saying to them, we have summer work available. Would you consider that? And this is the area. Because some people feel when they get their foot in the door, and it is very true, you get to know somebody over the summertime. It's a great opportunity. So could we develop some, a survey or something that would go out to all these applicants now that are applying for these positions in elementary to say, hey, we've got this program. Let's get it going.
That's a great idea. I hadn't thought of that. Thank you.
Just came to me.
Yeah.
Hit me in the face.
No, that's a great idea.
Yeah.
Thank you.
Okay, return to school plan,
Maybe
September
Trish can send
2021.
emails out.
Sure.
This is the most exciting part of my night because, just listening to the fact just the other day when it was released that we're going back to school and the virtual's out and we're back live, getting that out of the way, knowing that we could full-fledged jump into this. So, what do we
Yeah,
got?
actually, we're hoping, I don't know if the way I read it, it was definitively virtual is out.
No, I haven't seen that.
You're an optimist. I'm an optimist too. Because I'm reading to that.
I'm reading between the lines.
Okay. I hope, we do hope, we know NISBA sent something out
Right.
with that the commissioner was leaving a little bit of a door open. We do really hope that we will be back with no remote option for next year. We are still awaiting more specific guidance for next year, but full return to school. And again, that it doesn't apply to us because we've been full return to school. There are districts that have not yet returned, and so but we do hope that it says exactly what it means, exactly what you're saying, and that we will not have to offer remote learning. If we do, there's been many discussions with my superintendent's group about a different process and then possible ways of collaborating if there are students who have I guess, very special circumstances for whatever reason that might require them to not be in school. But we hope that with the positivity rate down so low and the COVID cases, and that more and more people will get vaccinated, that will not be an option and won't be necessary. But we'll have to wait for a final word on it. But Mrs. Heck, did you
Yeah,
add
so
anything?
just that, this spring we did receive updated guidance, as we all know, and we did revise our plan. Our revised plan is up on our website, as we were asked to do. And the governor did announce in the end of May that the plan is to have all students back in school. So at this point, that's what we know, and we will continue to monitor and keep track of what's happening.
Mrs. Frio has been working with our building principals to get the numbers for next year, as it stands with 3 feet. Do you want to speak a little bit about that, Mrs. Frio? Well, it's very difficult to plan when we don't have any specific guidance. We don't know if the planning that if these the guidelines of 3 feet and the kind of lack of discussion about barriers. Where do we stand with the barriers? Is 3 feet enough? Will there be masks that are required? We don't know all of those things.
No.
So it does make it a little difficult to plan in terms of space because some of our classes are large. So some of them have high numbers. And so without knowing exactly what the footage between, the social distancing guidelines will be, it's difficult.
You may remember last summer. I remember last summer very clearly where they gave us a 6 feet distance, but they didn't say whether it was 6 feet on center or 6 feet between the desks, and we all scrambled. And we here in East Rockaway went with 6 feet on center. We took the safe road. We were allowed to use barriers when we could not meet those guidelines. We rolled out bringing all the students back, and just after I ordered all the barriers and we brought, 75 to 80% of our grades back, the guidance came out revised. They took the word barriers out. Didn't really tell me why, but they took the word barriers out, and then they changed to 6 feet to 3 feet. Again, no definition on whether 3 feet is on center or between desks and between chairs. However, there are many classrooms in this district that if I had to put 3 feet between desks and between chairs and remove the barriers, we could not fit our children in the classroom. We just could not do it. I have children side by side with barriers, and that is how we fit the children in the class. There are many classrooms at elementary level where I have 3 children sitting side by side and barriers between them and between the seats. If you recall, I was very particular about the barriers being between where 2 children sit and not just in the front. So we really went out of our way to put barriers up to allow the children to sit closer because we could not meet 6 feet. And with all honesty, we cannot meet 3 feet. Here in the secondary building, we could not do that either. Each desk has a custom-made barrier. I'm moving forward with opening the school year, thinking that the conditions are going to be the same, and if not, I hope they're reduced. Because if they make me stick to 3 feet and they don't allow us to use barriers, we cannot do that.
And many other districts will not either. We're not the only district with the size constraints.
Yeah.
Most districts have small classrooms, and you've all seen pictures of other districts where the barriers are up and you have as many as 25, 27 kids in a class right next to one another with barriers. So, if that's not allowed to continue, we wouldn't be the only district.
No, we would
will
not.
be challenged.
And as usual,
We need
they don't think things through. They thought they were doing such a great thing, reducing it from 6 to 3, but they never gave any thought to what exactly does that mean to a classroom. Nobody walked into a classroom where there's a concern with class sizes. So I think our district has done a fabulous job. Our children have been safe. Our barriers are up. Some districts have taken their barriers down. We have opted to leave our barriers up as an additional safety for the students, for the teachers, for the staff.
because they feel more comfortable at the moment. And so that's the direction we're going until we get a directive that says we can go
We
closer.
really do hope we get more specific guidance that clarifies what the expectations are. If we don't, we'll continue with the model that we currently have.
Yeah.
We won't have any other choice, especially since it appears that we're leaning towards no remote. Now, other states, Connecticut and New Jersey, have stated that they will not offer a remote option. New York has not been as definitive yet.
Hopefully they give that guidance sooner rather than later.
Oh, it'll probably come in
But if-
August like it did last time.
Right.
Yeah.
But if this weekend is any indication, that was very unfortunate what occurred this weekend, and we hope that kind of confusion does not occur, because it was really unacceptable to have that kind of stress put on school districts and parents, and that kind of turmoil occur. So we really hope that there's clarity and that it comes out in a timely fashion.
Jackie, you talk about the barriers. If we didn't get any additional guidance and we stay with what we're currently doing, do we have enough of barriers
Yes.
to open up in September?
Yes, we are in a good spot right now. We don't have that many students remote. And we do have some extra barriers, some extra, actually the shields, the ones that the men made. So we are prepared if we needed to put a few more. I do have some classrooms that I am concerned about that have like 5 kids that are out on remote right now. That if I had to bring those 5 students into that classroom, I don't know how they would fit. So I do have some classrooms that even with the barriers would not meet the capacity. But next year, maybe they'll be spread out a little bit more. And that's what I'm looking at right now. Where are the classes right now, the enrollment right now that may not fit next year? And how can I make a fit? Maybe I need to change the barrier seating to be different. Maybe I need to put them in tables of 4, and that's what we'll work on now.
And I just want to thank the custodial staff again, because if you go in the classrooms, the barriers have held up
Yeah.
amazingly well.
Yes.
They are so clean, and they're in great shape, and that's really a credit to the hard work that the
Yeah,
custodians.
the custodians, the teachers, and the
I was
students.
gonna say
And the students.
are
The students,
So the fact that they have them still on and everything
Yeah.
is nice.
yes. I mean, they're,
Yeah.
And, the
You're just
teachers-
kidding.
yeah, the teachers
know
are,
the teachers doing the job.
guiding the students not to damage them, and the custodians are just doing a fantastic job of cleaning them every night. And it is a big job, on top of their regular work, it's a big job.
No, we do have great kids, and they're not, they are respectful. So,
Great. Good. Okay, policies?
Okay, so we have 3 policies that will be up for adoption. Superintendent Ruiz did send them home in Friday's update. The first one is school safety plans and teams.
So all of our bus counselors, listen up. You guys all did such a great job. We're so proud of all of you. Now we feel confident. You're going to be the best bus counselors ever. But the winner is, drum roll, Team 3. Come on up after.
very scary. Mr. Howard, do you have any idea
Eyes.
where that's coming from?
It was definitely like a team, something with a
Rolling
team.
River? We do have a new system here.
Yeah, these are all wireless. Never a dull moment.
Please, we're going to take a 2-minute break so that we can investigate what where the audio is coming from that's interfering with our meeting.
The bus counselor.
This new system could not because it's a closed system. But he's going to turn it on and watch now and see if it happens again.
All right. All right, Kristen.
All right, so we are back to policy. So there are
Commercial
3
break.
policies up for adoption this evening. The first one is school safety plans and teams. So that policy has been modified to reflect education laws that require the inclusion of specific pandemic preparedness protocols. And that is referenced in
Up and get
Law 27C in the district-wide school safety plans. I did have one question, Superintendent Ruiz. I know there was one part where we were going to discuss something with Alteryx.
Yes, there are two items to discuss with the board. One is the appointing the if the board would want to consider appointing a student representative to the district-wide school safety team.
Great.
Okay. So we'll leave that provision.
It'll be, yeah. What a great way to tie that in.
And then, actually, I did share the section on threat assessment teams with Alteris, and some of the language is optional, and so the building principal, in consultation with the superintendent, will annually designate a threat assessment team, which we do have as part of our emergency response teams in the building, to provide ongoing support and information in order to identify and assess individuals who may be potential threats to safety with the intent of minimizing acts of violence in the school community. So the wording of that just concerned me a little bit in terms of the responsibility put on the school teams. And so in a sense, we do evaluate if, we have students who there are concerns about, but our typical protocol is to, if there is an imminent threat, we would notify the police. And so I'm going to review the language with Alteris in a meeting next week and just see if it doesn't put a legal responsibility on the school team. Obviously, we have student support teams where if there are students who we feel are in danger of harming themselves or others, those students would be brought up and discussed. But again, if there was a significant threat, there would be other steps that we would take. So the language just does concern me a little bit. The second paragraph is students will be encouraged to bring their concerns to any district employee. If a district employee becomes aware of a threat to the school community, they must inform the building principal, who will then convene the threat assessment team. The building principal may request the participation of the following individuals who may have specific knowledge about the potential perpetrator: supervisors, teachers, students, parents. The building principal is responsible for keeping the superintendent informed about the activities of the threat assessment team. Threat assessment team members will receive appropriate training. And again, so that's a large responsibility. We are looking at, we are going to be moving forward with an anonymous reporting system. It's called Anonymous Alerts. Mr. Fisk is working with Mr. Contreras, our security advisor. We had looked into the Sandy Hook Promise several years in a row. And that is the organization that was developed after Sandy Hook, and they provide a free see something, say something, or see it, say it. I can't remember the name of it exactly. We were on their list. We had received initial training. However, they became inundated, and then COVID happened, and they are fully voluntary, and so they were not able to meet our needs this year. And we did look into the anonymous alerts. It's very, very reasonable. I think we're going to be looking at about $1,200, $1,500 the first year, and that will be on our website. And they monitor. We'll tell you the board more about it because we're in the initial stages of exploring that. But that would be a system that would be posted on our website, and any one who felt they had a concern with a threat of any type, they can report it anonymously. It's monitored by the company. It's also sent then to key administrators in the district. And so that would be helpful. But again, we do this, but it just seems like a lot of responsibility. And I'd like some language put in here that we also notify the police when there is a significant, if we are aware that there is a threat, our protocol is to notify the police. So I just would like to review that further and hold off on not adopt this
We're
on
gonna hold
Tuesday.
off.
Yeah.
Okay. Okay, so we're just gonna change that in the agenda as well, right?
Yes.
I'll add it to review. Okay.
And then Where did my agenda go? And then the other policies.
Okay, so the next one we had was pandemic planning. And this policy was initially developed to address pandemic planning for school districts. This is a new local policy that has been updated to address education laws that require the inclusion of specific pandemic preparedness protocols referenced in section 27C of the labor law and the district-wide school safety plan. So really, I think it's just looking at it, correct me if I'm wrong, we were looking at who was labeled as essential employees and adhering to executive orders.
Yes, this speaks to the new component of the safety plan, the district safety plan that we presented, I believe, in March. We did a presentation. There's an addendum to the plan that now we have to, the district safety team reviewed it. I reviewed it with all of the leadership of all of the units in the district, and now this policy reflects that new requirement. So we are ready to adopt this one.
You guys have any questions on that or?
No.
Yep.
No.
And the last. You are funny. The last one is non-discrimination and equal opportunity. This is a required policy that has been updated to reflect various amendments to state executive law, education law, and civil rights law regarding protection against discrimination on the basis of traits associated with race, such as hair texture and styles, religious practices, and gender identity.
And
Is that a regulation, though, no? Is that a policy or regulation?
This is a policy.
Policy.
Yep, this is a policy, required policy.
And there is a regulation for the complaint process
Okay.
that follows. And we did review this. I reviewed this as appropriate with Mr. Fisk. Our website is accessible, and we meet all the requirements of this policy. And this is a policy that we already have. So it's just being updated.
I was just thrown off by the R. Why is that a policy have an R on it?
Because it has regulations.
Within it?
Yes.
Is that it? Okay.
Mhm.
All right.
Yeah, it's 0100
And
and
then,
0100-R. Right, the
Got
R
it.
means the regulation.
Thank you.
And that just kind of gives you the procedures that we must follow
Yep. Thank you.
relative to the policy. So this is ready for adoption.
Yes.
Good to go. So we'll have two.
Mm-hmm.
Great.
All right.
Okay, are there anything that, any of the board members that was missed maybe on the agenda you want to discuss? Or you want to ready to roll?
So one thing I wanted to ask, and I don't know if it's something that we should look into or inquire about, but the Bay Park fields, how we were not able to utilize them in the spring. Should there be any contact to County Executive Kern regarding those for the fall, depending on where our fields wind up? If we're not able to utilize them in September, I know junior high soccer utilizes that field, football using it for practice field. It could impact the sports. So rather than be proactive to find out what's going on in that. Well, they can't play on it. They can't play on it.
We've been
Only
excluded
field
from
they
it. We
can
were
on
given
is
less
football.
than a week notice back in April.
They have
Just the baseball, football, that combination soccer?
Right.
Turf.
Softball is good. That's been utilized. We've been utilizing that. Yeah.
Yeah.
We use that for baseball practices right now.
Right.
But I believe, and correct me if I'm wrong, you would probably know better. I think junior high soccer uses that as their home field
They do.
during the season. So that would be, now we're in a situation like we were with Eisenhower Park
Correct.
this season.
That's what
I'll ask
And then
Mr.
that
Barth to
increases
follow up.
Transportation costs again, so just
Right.
things to think about proactive come the fall.
Thank you.
Great observation.
I'll have Mr. Barth look into it and then I'll report it out in the board update.
Great, thank you.
Hopefully, they'll have an answer from him.
Yes.
Yeah, well, at least we get, if not, we were ahead saying we had a letter in. They should really
Right.
get, you know, like what happened this year when they didn't, the last second, they're telling you what we have to do.
And even, I don't know if it was be recommended, a letter coming from the board to push a little bit for something to happen, considering that press conference was made down there, and we thought we were going to have utilization of those fields,
Okay, so if we have no further discussion, no other items, it is now looks like 8:08. I'd like to bring this meeting of the work session to a close. Thank you.
Great.
Thank you, Mrs. Rainey.
Yep.
Thank you very much.